yet, when a patient is rushed into the ER or an ambulance fighting for their life, what's the very first thing they do? Not blood pressure meds, not some high-tech emergency procedure. They inject 9 grams of salt straight into the bloodstream. And then, the miracle happens right before your eyes. Within minutes, the body, starved of salt, comes back to life. The patient starts breathing easier, the heartbeat stabilizes, blood pressure drops, and the person sighs in relief. Thank God. Thank you, doctor. You saved me. Except the doctor hasn't even stepped into the room yet. Let me tell you about my friend. He was admitted to the hospital with a dangerously high blood pressure, 280 over 180. The nurse immediately hooked up a saline IV. 20 minutes later, the bag was empty. Then she hung up a second one. Within less than an hour, he had received 18 grams of salt. The result? His blood pressure dropped by almost 50 points. No pills, no drugs, just salt. So here's the question. If salt is as toxic as we've been told, why do they use it as the first line of treatment in an emergency? The answer is simple. Because they know you're salt deficient. They know the human body needs roughly 7.5 to 12.5 grams of salt per day to function properly. And in critical moments, that higher dose of salt can literally save your life. The bitter truth? While modern medicine quietly acknowledges salt's life-saving power in the ER, out in the real world, they keep preaching the same tired gospel. Salt is bad. Eat less. Ask a doctor straight up, is salt good or bad? And you'll get the standard textbook answer, it's bad for you. But if you push further and ask, then why do hospitals give patients 9 grams of salt a day, 3 times the American Heart Association's limit? You'll see the curtain start to fall on the lie. This isn't just a misunderstanding, it's a manipulated belief system. A carefully crafted narrative repeated so many times that no one questions it anymore. And unless you wake up, you'll keep being a victim of this salt game. So, let's begin. What you're about to hear might be one of the darkest medical secrets of the century.